Today's presentation will be given by John Schall, who is the CEO of Caregiver Action Network. He has been recognized nationally as a thought leader on caregiving issues and trends. Schall effectively links private sector goals with healthcare public policy. He has been working as a healthcare expert in the nonprofit sector for years and is considered a national leader on a caregiving issue. He also has extensive government experience. He was deputy of the White House Domestic Policy Council under President George H.W. Bush and chief of staff of the U.S. Department of Labor. So I think he really understands the workforce issues all of us face. Please be sure to ask questions and take advantage of having him on our presentation today and having him as a subject matter expert. John, at this time, I'll turn it over to you.
Thank you so much, Sarah, and thank you all for joining us today. I want to be able to use today's session to talk to you about a very important, but often, far too often, overlooked issue with your employees, and that happens to be employees who happen to be family caregivers. So that's what we're going to talk about during the course of this hour. Who these employees are, what they do, what they need, kind of the challenges that they face, what it means for them as they're juggling family caregiving responsibilities with their work responsibilities. And very, 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 very importantly, what it means for you as employers, and then what you should do about these situations. A bit, if I could, just for a minute, about Caregiver Action Network itself. I'm the CEO of Caregiver Action Network here in Washington, D.C. CAN is the National Family Caregivers Association. In fact, we still legally have that name. We've been around since 1992, so we are the country's leading family organization nonprofit that's helping those tens of millions of Americans across the country who are caring for either an elderly person at home or someone with a chronic condition or health condition in their family or a friend or loved one. This slide gives you just kind of a snapshot of a little bit of the ideas of the many faces of caregiving. You know, as I said, there are tens of millions of these of us across the country. In fact, our estimates are 90 million Americans happen to be family caregivers. And the family caregiving situations obviously vary tremendously. But you can see here, you know, we will really be focusing on those of us who are caregivers while we're holding down a job and what that means in the company context. But the caregiving situation itself really spans the gamut. It seems obvious, but there's a reason I'm emphasizing this. You'll see here individuals, you know, my mom has Alzheimer's, or you know, my daughter has a rare disease. My wife was just diagnosed with MS. The reason I'm bringing up these particular types of examples is because the first thing we have to realize with family caregiving is not just an elderly issue. Family caregiving is across the lifespan. And this is something I always have to emphasize because some organizations like AARP, you know, will talk about family caregiving as just somebody over the age of 50 caring for someone over the age of 65. Well, there's a lot of that, but that's only 50% of the family caregiving situations across the country. That a lot of us are caring for someone, you know, who isn't elderly. When you're talking about multiple sclerosis, for instance, and I'm sure many of you know this if you have people with MS who are employees in your company, you know, MS hits in its 30s. 2 out of 3 times it's going to be a woman as opposed to a man. So there the family caregiving situation, you know, is a 30-something-year-old spouse caring for a 30-something-year-old person who has a condition. So we need to disabuse ourselves of the notion that it's an elderly issue. It really isn't. There happen to be 17 million Americans who are parents of children with special health conditions, like autism or something like that. So family caregiving really is a lifespan issue, so we have to keep that in mind as we go through this. I think, importantly, this is one way we figured out of talking about it, especially in the employer context, because those of us who are, like me, old enough to remember when we were talking about in the 1980s, and child care became the issue du jour, and we're all talking about how to, you know, address child care. Well, to some extent, we're still addressing how to address child care. But For these years, family caregiving really is today's issue, just like child care was in the 1980s. Now, why do I say that? In fact, more than 22 million Americans are people who are working and being family caregivers. So what does that mean individually in your company? It means that on any given day, nearly 1 out of 5 of your workers happen to be family caregivers. And that's in real time. If you actually look over the course of a year or two or later, or even longer, you'll see that that number is even bigger. Because a lot of us end up in family caregiver situations, either ad hoc or as people age or for whatever reason. But on any given day, 1 out of 5 of your workers are family caregivers. So that makes it a fairly important issue to address in the workforce. Just a couple of minutes first on who actually family caregivers are, because we kind of talk about them in the abstract here, but it's important for us to get a handle on exactly what we're talking about. Family caregivers, as I said, this has become really quite common, that now 2 out of every 5 adults identify as a family caregiver. That's 39% of all adult Americans. And the thing is, this has increased quite substantially in just the last few years. So when people talk about family caregiving, they have this notion, it's the average caregiver is a 49-year-old woman. She's married. She's working full-time. She has kids at home, and she's caring for an elderly mother or mother-in-law. Well, yes, that's true. It's still true. But if that's all anybody tells you about family caregivers, stop listening because they don't know what they're talking about. Because what's fascinating is what's changed in the last 3, 4, 5 years. And what's changed in the last 3, 4, 5 years is simply because of the demand of family caregiving has become so great. Men are now almost as likely to say they are family caregivers as women are. And that is a big, big change. Interestingly, too, and we'll get to this in a few minutes when we're actually talking about what it means in implications for the workforce, young people, millennials, are almost as likely to be family caregivers as well. Alzheimer's is a pretty good example. You think of Alzheimer's, some, later working age type person caring for an older person. And actually it's fascinating that that's really not the case. Certainly Alzheimer's is exploding exponentially, so there are 15 million people across the country who are caring for now about 5.5 million people with Alzheimer's. But what's fascinating is more than 1 million of those people caring for someone with Alzheimer's, the primary caregiver happens to be a millennial between 18 and 29. Usually somebody caring for a grandparent with Alzheimer's. The point I'm trying to make here, and I hope we're kind of getting this, is that family caregiving has now become ubiquitous. As I said, on any given day, 1 out of 5 of your workers are caregivers. 2 out of every 5 adults really identifying as a family caregiving. We actually crunched the numbers on this. So how common is that? It's one thing to talk about numbers. Think of the people around you. Think of the people who work in your company. Family caregivers are as common as people with brown eyes. So if you just think of everybody, in your company, the blue eyes, the green eyes, the hazel eyes, the brown eyes, all of those brown eye folks, that's how common family caregivers are. Obviously, this is becoming ever more important as the demographic of America ages, and that people really want to age in place. Nobody really says, waking up in the morning, gosh, I wish I can go to a nursing home. So everybody wants to age in place. And what most people don't know is that most care for the elderly, 80% of it, is actually provided by family caregivers. But again, like I said at the beginning, I don't want to leave you with the notion that it's just the elderly who need caregiving, because that is not the case. That would be a wrong notion that we get from other organizations that just cater to seniors. In fact, the number of parents caring for children with special needs is also increasing exponentially. Just like Alzheimer's is exploding, well, childhood cases of autism are increasing exponentially too. We face an interesting family caregiver situation that we never saw before with wounded veterans. You think of the wars in Iraq and Afghanistan, and I know a lot of you have veterans who are employees in your companies. Well, think of it. Even if we just look at post 9/11 Iraq and Afghanistan wars, there are more than a million Americans who are caring for some of those service members. This is a different situation. Why? It's a different situation because in this case, those wounded veterans have injuries, quite frankly, that they would not have survived previously from previous wars. You have triple amputees, you have fairly traumatic brain injuries, wounds that frankly people would not have survived before, they now survive. And so it creates a whole different family caregiving situation at much younger ages than we saw before, where now it could be a married couple in their 20s and they're looking at a situation for the next 50 or 60 years of both working and juggling family caregiving. An interesting statistic, just before we get into actual details here about individual workers and what it means for individual companies, a lot of people don't know this. Family caregivers are really the backbone of the nation's long-term care system. This is a number that RAND Corporation put together, so it's not a number that I generated as the CEO of the nonprofit. But economists actually have taken what is the value of the care that family caregivers provide. $522 billion each year. You know, $522 billion, how do you make sense of that? What does that really mean? Well, if you take every dollar this country spends on Medicaid, both at the federal and state levels, so all federal and state Medicaid dollars, this is bigger than that. If you take all the dollars the U.S. spends on paid care in the home, nursing homes, assisted living facilities, put all those together, this is twice as big as that. $522 billion is almost as big as Medicare itself. So that's how large the support is that's coming from family caregivers. If all of us family caregivers went on strike tomorrow, not that we'd ever do that to our loved ones, but if we did, there's no way the nation could fill in this gap. I want to talk about a couple of minutes about what family caregivers face, because when you get a handle on this slide here, you'll see what it really means in terms of impact for people who happen to be family caregivers, but their impact on them as a worker in the job at their company. Very, very importantly, let's start with depression. The fact is that simply because of the stress of the role of being a family caregiver, the studies show that family caregivers are twice as likely to suffer depression. So just by virtue of being a family caregiver, those employees of yours who are doing family caregiving, twice as many of them have depression as your other employees. If we're actually looking at women, the numbers are very, very, very compelling. Depression for wives who are caring for their husbands is 6 times higher. So a wife who is a caregiver for her husband is 6 times more likely to have depression than a non-caregiving wife. It isn't also just depression. Chronic diseases, more than twice the rate of non-caregivers. You'll see in a couple of minutes why this matters in the employer context, because what we're talking about is your employees happen to be family caregivers, themselves are sicker and more costly. Chronic diseases, what do we mean here? Hypertension, diabetes, the kind of conditions that actually can cost quite a bit to manage, and cost quite a bit if we don't manage them correctly. And interestingly enough, actual chances of death are higher just from the family caregiving role. Just point out these numbers here. They're depressing, but you can see them. The husband's chance of dying within a month if his wife was in the hospital, 35% higher. And mortality risk for the wife, if it's the husband who's been hospitalized, is even bigger than that, 44%. I also want to mention the financial component here, because that's going to matter a little bit too when we get into how we worry about this in a workforce context. Family caregivers have to spend a lot of money out of pocket. On average, according to Genworth Financial, it's $10,000 per year. You know what you're paying your employees. You know, median family income in the United States, just under $60,000. So $10,000 is a huge, huge chunk. For what? Well, if your mom needs Depend because she's incontinent after her stroke, happens to be my case with my mother, that stuff's not covered by insurance. It's not covered by Medicare. Those nutritional drinks, you want to buy Ensure for them. A blood pressure monitor for the home. All these things adds up, gets to be quite expensive. My point here is that family caregivers themselves, because of the stress of the role, are themselves sicker. And because they are sicker, when you are thinking about them as employees, realize there's huge potential overlap between subpopulations of your workers. Probably a huge overlap between your workers who are family caregivers with your employees who have a disability or some condition. Because again, the simple stress of being a family caregiver has made it more likely that they have a condition such as that. So it's important to realize we're not talking about necessarily just a separate 20% part of your workforce. That 20% is definitely overlapping with subpopulations that you're worried about for other reasons, like your workers with disabilities. I do want to talk about the financial impact here of caregiving because we know from the dollars that there is a tremendous real loss, significant costs of caregiving to businesses across the country, like yours and everybody else's. The first big component of the costs of companies nationally, excuse me, which we estimate to be at least $50 billion, is productivity costs. There are a lot of productivity losses, and we'll get to those a little bit in detail in just a second. But productivity losses, you know, from things like absenteeism, of course, because you have to go, family caregiving just happens. Something's happened in real time, you got to go do it. A lot of workers having to shift from full-time to part-time work, a lot of workday interruptions. You can see how the productivity costs add up. That seems fairly obvious. It's bigger than people realize, but it's fairly obvious. What people don't realize is productivity costs aren't the only costs. For you as employers, there are significant higher employer-related health care costs. Again, why? Because family caregivers are operating under such stress, they themselves more likely to have chronic conditions, they themselves more likely to be depressed, they themselves more likely to have a stroke. Their health care costs are higher. So on average, if you just look at overall, it's 8% more for family caregivers overall who happen to be your workers. If your company happens to skew blue collar, it's even higher than that, the 11% higher healthcare costs for those particular employees. And if your company happens to skew heavily male, well, a lot higher, 18% more. For male caregivers, why is that the case? Well, I say this as a male caregiver myself. You know, men, we are notorious for not going to the doctor until it's too late, right? We really wait for something to happen. We just kind of avoid going to the doctor, and then, you know, you kind of get in a more serious situation because we've waited. So the healthcare costs for those of us who happen to be employees and male caregivers is even higher. And then, you know, in a lot of cases, you actually lose that employee because of their caregiving responsibilities. They actually leave the workforce. So the expense of recruiting and training new employees to replace them is really quite high. Actually, we did this with Kimberly-Clark Corporation. And Kimberly-Clark actually did an analysis of how much it takes, how much money it is to recruit and train somebody to replace an employee who left because of their family caregiving responsibilities. And the number Kimberly-Clark came up with was 150% of the annual salary. So if you're trying to calculate what it costs you because you lost an employee because of their family caregiving responsibilities to find someone and train someone new, take that salary, make it 150%, and that's your cost. What does this mean for the individual worker? Thankfully, the studies have been pretty good in going into this. And so I'm going to give you a lot of numbers here, but I think you'll see the point. There's no question that caregivers' careers are quite extremely impacted by providing care. If you ask them themselves, self-reported, more than half of them will say that their career was negatively impacted, right? They had to give up a promotion, or they had to do less work, or something like that. Another thing people don't realize is they actually lose a lot of money. The average income lost, again, Genworth Financial's study, is at about 33%, right? Why? Again, because you may have foregone a promotion. You may have foregone working overtime hours. So you actually lose a lot of money. As we mentioned, there are some situations where family caregivers actually leave the job. They quit or they get fired because of the caregiving responsibilities. This happens more often than you would think. 11% of caregivers lost their job, maybe quit their job, because they're providing care. So you can see negatively impact, a lot of money being lost, sometimes lost their job. All of that's on top of what we already said, out-of-pocket expenses that they're paying $10,000 a year. And all of this, again, has increased quite substantially since 2002. That's the big change in America from these last few years. Let's talk about it from your guys' perspective. You know, your talent acquisition folks, your HR folks, you're the ones who are worrying about these issues, employee-related issues in your workforce. So what does this mean for you? 6 in 10 caregivers. The majority of caregivers are people who are working. Again, counterintuitive. We tend to think of family caregiving, oh, that's elderly grandma and grandpa down in Florida. When he's sick, she's taking care of him. When she's sick, he's taking care of her. Well, yeah, that's still very much the case, don't get me wrong. But guess what? That's not the majority of cases. The majority of cases, family caregivers are people like you and I on this line. We're doing it while we're working. So if you look at those of us who are family caregivers and working, the vast majority of us will say, yeah, had to make some sort of accommodation because of this family caregiving situation. I had to cut back on my work hours. I had to take a leave of absence just because I just simply needed to be with my loved one at home and couldn't be in the office. A lot of times I've actually received a warning from the supervisor or the manager about performance or attendance because I have to, you know, juggle these family caregiving responsibilities. I want us to realize a couple of things here. And again, it's not something that you would intuitively necessarily think is the case. Most caregivers, most of our workers who are family caregivers are not that old. This is not really a problem of your 60-year-old, your 63-year-old, your 64-year-old who's close to retirement worrying about family caregiving. Yes, that may be the case because we're all in this, but very important for us all to realize. Most caregivers are in the prime working years of 25 to 54. Most family caregivers are in the prime of their career, prime working age, not close to retirement. So that makes a huge difference on how we manage this issue in the workforce. 3/4 of them are missing time from work. Again, a big increase since 2010. How much time are they missing from work? On average, 7 hours of work per week. So it's pretty substantial. And again, a substantial increase in just the last few years. And in fact, of those caregiving employees, 1 in 5 of them are actually missing 10 or more hours per week. So the 40-hour work week, you know, missing 1/4 of the hour. All right, I throw in all these scary statistics. Why? Not to scare you off of family caregivers as being your employees, not to make you realize, oh, don't hire those folks and try to avoid them. You can avoid them. We're ubiquitous. We're as common as people with brown eyes. We're all of us in this situation. Rosalind Carter, former First Lady, says, eventually every one of us is in this situation. So I don't throw these horrible statistics to say, avoid these people like the plague, they're going to be bad employees. You can't do that. They're great employees, they're greatly talented, everybody's in it, and they're ubiquitous. It just means, yeah, there's a huge issue that we have to resolve and figure out how to manage because there are costs to the company in a way that can be managed. It's interesting, Harvard Business School just put out a study in February. We helped them launch it and announce it. The perceptions between the company and the employees are vastly, vastly different. The Harvard Business School study showed that if you ask the employers, only about a quarter of them believe that caregiving, is much of a big deal when it comes to workers' performances. You ask the employees themselves, thank God they're being honest about it, very different perception. Almost all of them, 4 out of 5 of them say, oh yeah, there is no question it has affected my productivity. So what your company is perceiving as a problem is really dwarfed by the nature of what's genuinely happening out there. I keep talking about costs, so I thought, well, it's irresponsible of me to say, costs, but not to actually give you some sense of how much it costs. So we did this calculation as well to actually crunch numbers for real companies. The numbers show lost productivity, the studies show. It's 20% productivity reduction because of this. That's a $2,400 loss per person per year. And remember, 1 out of your employees is a caregiver at any given time. Those higher health benefit costs that I talked about just a couple of minutes ago, on average 8% higher. Again, even higher for blue collar or male workers, but let's just take the average here. And again, you know better than I do how much you spend as an employer on each of your employees if you're a self-insured company. But let's say it's $10,000. So you can see how this quickly adds up to an annual business cost of $3,200 per employee because of the family caregiving situation. Now, I don't want to be Debbie Downer here and say, okay, so guess what? We're all just going to lose money because of this. On the contrary, I think there are ways to manage this, and that's why we really wanted to have this conversation today. So clearly, why do you as companies need to support your employees who have new family caregivers? Well, huge costs nationally. We saw that from both the productivity losses and the healthcare costs. You can see that most will report work disruptions because of family caregiving. The productivity decline we talked about, you can actually measure it. It's 20% productivity decline. And those employer-paid health benefit costs, right? This is not talking about that person's overall health benefit costs, it would even be higher than this, but portion that the employer is paying because those family caregivers are just sicker because of the stress of their role, the non-caregiving employees 8% higher. So obviously supporting these employees with their family caregiving challenges will help you reduce those employee costs. It's worth taking a second or two on what do workers actually want? And this is interesting too. We have some interesting views from a Ceridian study as well as the Harvard Business School study from earlier this year. And I think the first part of this slide is actually quite telling, if you think about it. The fact is, most of the time now, if a worker has a family caregiving situation, juggling their family caregiving challenges and responsibilities while they're on the job, by and large, most of the time the supervisor is aware of that. So it really isn't hidden. I mean, there is a stigma, so sometimes the worker doesn't say it, but by and large, it just kind of comes out, right? You see it. In fact, if you're one of those caregivers who it's a fairly intense caregiving situation, the supervisor is actually aware of it 3/4 of the time. So it's not unknown. What's fascinating, though, is that even though the supervisor and the manager is aware of the situation, only half the time will the employee say that the manager is supportive. So here you have a really important perception problem with your workers, that by and large, your employee would say, yeah, you know what, my supervisor knows I have this fairly tough situation while I'm doing this family caregiving and managing my job responsibilities. But no, I got to tell you, to be honest, company, I don't think my manager or my supervisor is supportive. That's a problem. It's a problem in your company if the employees do not think of their managers and their supervisors as being supportive. So the bottom line from this, again, Ceridian saying it, not me as the CEO of the national nonprofit that worries about family caregivers. I wish I had said it. It's a great thing to say. But this is Ceridian saying it as a result of their study. Today's working caregivers are looking to their employers for support, guidance, and assistance. So, what do your workers want? They actually want you as companies to help them support, guide, and assist them with their family caregiving responsibilities. Talent acquisition, clearly important right now in a situation where we have kind of record low unemployment. We're all trying to get the best workers, keep them around. Again, we just said today's workers are looking for their employers for support, guidance. And I think another part of this, and you guys know so well, today's workers, young people, they're looking for these, for lack of a better word to call these things, lifestyle benefits. A 30-year-old isn't necessarily looking for a pension. They don't know what that word means. That goes back 2 generations ago. Nobody gets a pension. They're not looking for that as a benefit from their employer. They are looking for these lifestyle benefits. And there's a whole kind of set of these, and you guys know what they are because you deal with them all the time. Family caregiving is certainly one of those they're looking for. And remember, again, I want to stress this, because if we miss this point, we've missed how to manage the situation. Most of these caregivers are in the prime working ages, right? So we're not talking about, how do I just manage this for my 63-year-old? That isn't the case at all. You'd be amazed at how many of your 25 to 35-year-olds are very, very, very keyed in onto this family caregiving issue. Most of these employees who happen to be family caregivers are younger than you think. Most of them are in their prime working years. All right, so all of that's the situation. What can we do about it? And here's where I want to say that can be somewhat helpful, and hopefully can be helpful to you guys. Again, I'm a nonprofit organization, so everything we do for family caregivers is free. I'm not a vendor, so I'm not a company. I just want you guys to be able to help your family caregiving employees, keep them happy and healthy, and be able to use their talent so that you guys can go all make $1 billion. As a nonprofit, I don't have to worry about that. Before I get into these next few slides here about the types of resources that we have that can be helpful for you with your employees having to be family caregivers, let me say one thing about family and medical leave and more paid leave and more flexible paid leave, because that's always going to be the first thing someone's going to ask. Well, the fact is, yeah, by all means, right, more flexible paid leave certainly helps. Family caregiving is not like having a baby, right? With maternity leave, a pretty good sense of, at least generally speaking, when the event's going to happen. We know ahead of time, can't pinpoint it to the day, or maybe even within a week, but we have some pretty good sense of when it's going to happen. Can have a pretty good sense of how long we want maternity or paternity leave to be after the fact. Family caregiving is not that at all. Family caregiving happens in real time. I get a call at 2:30 in the afternoon at my desk from my sister that my mother had a stroke. That's family caregiving. I'm up and out of here and going to the hospital. I have a loved one with a chronic condition, and now it's really flared up, so I got a problem for the next few days. Or now something's really happened, and we have to do a lot of back and forth doctor visits. So it isn't planned, it isn't scheduled, and it may not necessarily be for long term. It could be for a couple of few hours at a time. Certainly more flexible paid leave is terrific. Having said that, you are not going to hear from me that you'll hear from a whole bunch of people. Go and do more paid leave and make it more flexible. I think that's an automatic, but it isn't the answer. Why do I say it's not the answer? Because that stuff is all after the fact. If that's all you will do as an employer, all you will be doing is chasing the tail of this situation. I want to be very clear that I think what is in your best interests, what really helps, is to put the supports in place ahead of time so that as family caregivers are facing the challenges they always face, they have those supports in place so that they don't need as much of that time off, so that the productivity loss isn't as great in the real moment. Before I start talking about some of these resources, let me give you an example, right? Because it sounds like what I said is, maybe that's profound, but what does that mean in real life? If I need a senior living facility from my mother in Florida all of a sudden because now she's gotten so bad that she just can't stay in her own home, I'm probably in my office in New Jersey going to be making those calls during office hour times, right? I can't make them at 10 or 11 o'clock at night. The senior living facilities in Florida aren't going to answer the phone. So there is a productivity loss because of that. If I have, as an employer, supports in place for employees to do that, it's going to happen anyway, right? I'm not happy that it happens on work time, but it's just a reality. It's going to. But if we had the supports in place, for instance, you'll see something like CAN has to make it easier for people to find good facilities, and it takes 2 hours of time during the workday, as opposed to, let's say, 8 or 10 hours over the course of several workdays, you've dramatically reduced the productivity loss. That's what I mean about supports in place ahead of time, and not just thinking about flexible paid leave after the fact. After the fact is after the fact. But if the supports are in place before to help with those challenges, then you've helped reduce some of your losses. Well, we have a lot of resources, a lot of things that are available that help people do this kind of stuff, technology solutions, some of which here are actually cutting edge. Most people wouldn't know that they exist. Again, if you're a family caregiver, of someone with multiple sclerosis, you tend to go online, Google multiple sclerosis, you become an expert on MS, but you never think to Google, is there help for me as a caregiver of someone with MS? Because of that, there are a lot of things very helpful available to you you wouldn't know about because you don't think to Google them that way. That's why I hope people will come to Caregiver Action Network to find them, and we can direct people to them. Tools, obviously, because what family caregivers are doing is actual real life stuff. They're managing the medications for the patients. Most patients, believe it or not, do not manage meds themselves. It's the family caregiver up to 70% of the time who's managing the meds. So you better believe if I'm managing the meds for my loved one and I'm also working full time, yeah, that's something I want to make sure I do easily so that I'm not too much taking time out from my work. Support groups, asking for help, just some examples of what we do as CAN. Just a couple of more minutes here, and then I'm really going to open it up for questions because I want to hear what's on your guys' minds that we can be helpful with. One of the things we have found most helpful for real people, and please share this with your employees, 10 tips for family caregivers. You see it here in graphical form. Things like make sure you're taking care of your own health, right? Like be screened for depression, because guess what? It's going to happen. How to communicate with doctors, new technologies, legal documents, medical information. Just showing it here in graphical form because it's all really one page. It's a good thing for people to have it. They like to see it that way. But in fact, if you go on the website and use these 10 tips, there's a big important difference. We wanted to make sure that when we give you a tip, like make sure legal documents are in order, instead of just haranguing you to, yeah, go make sure legal documents are in order. Well, if I knew how to make sure they were in order, I would just go ahead and do it. I don't need that advice from you. So on the website, actually, each of these 10 tips would be linked and link you to the resources of how to do that tip, right? The whole point here is to actually help a family caregiver do it, not just harangue them and tell them to do it. So even though you don't see it in the graphic version, if you send your people to these 10 tips, it actually links them to the resources of how to do it. I just want to take the last couple of minutes to mention a couple of other things here for you. We are now launching, you're actually one of the first groups to actually see this. We won't officially be launching it until November 4th, but big heavy lift for us as a national nonprofit, but we're doing it anyway. We will actually have a national caregiver help desk for free for any family caregiver who can call, chat online, email in any way that they want to, this caregiver help desk, to get real-time, real-world help on any of those challenges from A to Z that come up with family caregiving. I say A to Z because family caregiving is like life itself, right? Sometimes you need to know how to manage medications. Sometimes you need to talk about your own depression. Sometimes you need to figure out a senior living facility. Sometimes you want to arrange transportation or meals, or sometimes you just want to be heard because, frankly, you're angry as hell about this situation. It's not what you wanted, and you just need to vent. So this is now actually up and running. Hugely helpful. It is something we went through a lot of trouble to get up and running. It is staffed by a group of professionals who are all trained in this. They're all experienced in being clinical social workers or nurses or something of that sort. But no medical advice is ever dispensed through here. It's how to meet family caregiving challenges. So it can be a terrific help in reducing those productivity losses and reducing the stress levels of your workers who happen to be family caregivers. The last thing I want to mention, just in case companies are actually interested in doing this and taking it on in a real way, just showing you a screenshot of a homepage of something we created called Assisting Caregiving Employees, ACE. So we as the national nonprofit realized some years ago that, companies need to address this, right, for their own sake, for their employees' sake, who happen to be family caregivers, and that meets my mission of trying to serve family caregivers and meeting them where they are, and if 60% of them happen to be in the workforce, I want to be able to help them out in the workforce. So we went ahead and created a website that there's a little fee-for-service component here. We're a nonprofit. We're not trying to make money, but have to maintain the cost of this thing. So a company could actually take this turnkey-ready website that we have developed, branded with the company's name if they want, but the resources come from the nonprofit White Hat Association, and has a whole robust series of resources and supports in here. Remember I said, really what you should have is the supports in place ahead of time with your workers who happen to be family caregivers so they can meet those challenges and not just be worrying about more paid leave or flexible paid leave after the fact, but have the supports in ahead of time. So this is just a home page. This is actually behind here about 400 pages. It's a fairly sophisticated wireframe of content and resources and help for people within the company with their family caregiving challenges. It's in all forms. Some are articles, some are videos, some are on-demand webinars, all sorts, because we realize people need all sorts. I could take 2 hours just to show you what's in here, and happy to do that for any companies that might be interested. We also purposely did one thing, as you might see here on this homepage, that there are a lot of resources for the individual worker with their family caregiver stuff. If we went into this navigation, you would see it gets really quite deep, quite fast. Very user-friendly, but extremely robust. Again, hundreds of pages of content on the type of issues that you might need, everything from your own resilience to anger and guilt and the nuts and bolts of medication lists and patient files and that sort of thing. But also purposely put in resources for supervisors, managers, C-suite, but also frontline. Right? There's a lot of EEOC guidance that people should know about. A lot of discrimination lawsuits now that happen, 2/3 of which actually get settled in favor of the family caregiver if they decide to take an action against a company because I think they're being discriminated against because of their family caregiver responsibilities. So resources in here, again, meant to be very, very easy. Right? If you're a frontline manager and you have 10 people, we don't want to make you a family caregiving expert. That's our job. That's not your job. You have a real job to manage people. But we have basically a 20-minute webinar in here for you as a frontline manager. 3 things. What do you need to know about family caregiving? What's the right thing to say to your employee who happens to be a family caregiver? And 3, what to tell them, which is basically direct them to the resources that are available right here. So that you quickly, have recognized it, seen it, said the right thing, and actually put them in a useful direction. Meant to actually make the life of the manager much easier and take a huge load off of an HR office where an employee may come in and regale you for 2 hours with their problems because they are real problems and really not knowing what to do for them. So it has been extremely, extremely successful. It's really quite a powerful online suite of resources that companies can use. Again, a small fee-for-service component for it. But with the stuff from just doing this for 27 years, we happen to know are the types of supports and resources that a worker needs when they happen to be facing family caregiving challenges. Well, I have said an awful lot, given you an awful lot of numbers, an awful lot of information. I hope maybe pointed you in some directions that can ultimately be helpful. Please know that as the national nonprofit, we are here to be helpful. Again, we're not a vendor. I'm not a company. I don't have to worry about making $1 billion. We're just here to make this all work better for those 90 million of us who happen to be family caregivers, knowing that 60% of us are in the workforce, so helping you support your employees who happen to be family caregivers so that it makes their lives a little better and makes it work better from your company perspective. Lots of ways to stay connected with us. Caregiveraction.org is the major website where all this can be reached. That number there is actually the help desk, but the help desk can also be reached through caregiveraction.org because it's also a chat and an email function. It doesn't have to be telephone. Any way someone wants to reach it. And all these other ways of staying connected with us. But with that, that's a bit of the overview I wanted to give you to leave you very much with the sense that it's an important issue. A lot of your workers are in this situation. It does matter to you as a company in a very, very important way. And yes, there are some very available ways to manage this situation so that you can keep your workers as productive and as healthy as possible. So with that, we are happy to open it up for our remaining minutes for any questions from all of you. And any of those of you who want to contact us directly, please reach out directly and we can get to you as a company as well.
Thank you, John. That was a lot of really great information, and I wanted to sum up a couple of your points by asking a question, and to reiterate the point about the fact that caregivers can really be anybody and especially fall into any age group. So I myself, I will disclose I'm 30 years old, so I'm technically a millennial, and I am a caregiver myself. So just as a living live example of somebody who identifies with that, that's me. And I'm a caregiver to my husband as well, who is also a millennial. So it's not just millennials potentially caregiving to parents or aging family members. It can really be any situation. So this is why this topic in particular really resonates with me. And I really wanted to have you reiterate some of the how-tos, the takeaways, the tips for employers, recruiters, hiring managers, really everybody that's within an organization. So for me personally, I know it was really beneficial for me to know about our flexible work schedule and policy within the company, and that's one tip that I know can be really helpful for recruiters and hiring managers especially to share with candidates, because being a caregiver is something that's non-apparent. You can't look at somebody and know that they are a caregiver. So one way that you can show that your company is inclusive potentially and has an environment that is supportive is to share any benefits like that proactively. So for myself, when I had to take some time away from work and change my schedule to care for my husband, I did not have to wonder or go through the anxiety of thinking about, is there a flexible work option or schedule with my company? I already knew, it was already public information. It wasn't something that I, again, had to torment myself about and then think about, do I feel comfortable disclosing that I'm a caregiver to my manager or to anybody else within the company? So going along with that, I wanted to ask you, is there anything else that you can think of as a tip for what companies can do, or just even colleagues, just to make sure that other people within the organization and on their teams know about benefits? Or is there something else that can be shared that might make caregivers feel more comfortable proactively?
Thank you, Sarah. That's an excellent question, and thank you for sharing your personal experience, because it's just the best illustration of, yeah, this is, I mean, a 30-year-old, this is exactly what we're talking about. And you're not going to know by looking at that person. I mean, look around in your workforce, and you're not going to necessarily be able to tell who the family caregivers are. So for HR, talent acquisition managers, et cetera, in the first instance, it's just worth being aware that a lot more of the people you're interviewing, trying to recruit, et cetera, are going to have this on their mind than you realize. And you won't just by looking at those people, you're not going to figure out who they are. So you certainly want to be aware of the issue. I love this idea of letting employees know that, you know, there are some things that the company does that would be helpful to them. And let me say kind of in a real concrete manner what I mean by that. First of all, what I don't mean by that, you know, it's what we all do as employers. Oh, and by the way, we have an employee assistance program, so please know you can always contact the EAP on, and we kind of trail off. And, you know, as we all know, very, very few people use EAPs, you know, maybe a couple of %. And those EAPs wouldn't do anything on family caregiving anyway. So that's not what I'm talking about. But what I am talking about is, again, because you don't want to wait for the family caregiving situation to happen. You don't want to wait for the family caregiver to have to come to you. Some communication messages, and actually we can help companies craft these messages. We've done it. Just so you know, family caregiving happens. So, by the way, as a company, you know, we do have this flexible work schedule. Or as a company, guess what? We have an employee resource group. We have found that those companies that actually have an employee resource group for family caregivers, one, it's amazing how well attended those can be, how very useful they are, and what a huge difference it makes to those employees. And if, let's say, you're a company who actually uses CAN's ACE program, Assisting Caregiving Employees, we actually help you craft those messages ahead of time to be able to say to all employees, look, you may need this now, you may not need this now, you may need it later, you may not need it. Just so you know, here's what's available, here's how it helps. The very fact that you've said that has already increased employee satisfaction and happiness quite considerably. And then they just always know it's there when they need it. So it does make a huge difference, and we can help companies craft those messages. So in addition to the flexible work schedule that Sarah mentioned, I do think employee resource groups help. There are little things and big things, and you know, we're always happy to talk to you one-on-one about what works for your company. But let me give you a little thing. Let's say you're a company that, you know, a lot of the people work in a bullpen kind of a situation, maybe a bunch of cubicles, maybe not even cubicles anymore. Well, family caregiving happens. I need a place, frankly, where I can make that phone call to talk about, you know, my spouse's health condition with healthcare professionals or whoever, without having all my colleagues kind of, unfortunately, either having to hear me or wanting to hear me, right? And it sounds so simple, but you'd be amazed how often it's not the case, that a workplace won't even have a small place where you can have that private conversation. So it can be as small as that, or as big as having the website company branded support program that we have in place, and then just letting people know that that's kind of available, because it does make all the difference.
Absolutely, and I think the ERGs are a great suggestion as well. I think there's a lot within organizations that can support caregivers, and we don't always think about how that can really overlap and really what to share. I also wanted to ask you, do you think that in general, employers are becoming more aware of the predicament that their caregiving employees might be facing, whether that is to disclose being a caregiver or how to ask for help, and what do you think is causing this increased awareness?
Oh, that's an excellent question, Sarah. So let me talk about that for a second. Increased awareness, because it actually goes in two different directions, and it's important to kind of tease it out. I do think, yes, in the last small handful of years, by and large, employers are more aware of family caregiving being a situation that they need to address. For a lot of reasons. One, just more of us are in the situation, so even if us as C-suite or HR managers become family caregivers, then we've realized it's become an issue. So some of that's just organic from our own life experience. And then, people are talking about it more, so it's not as hidden. So yes, they are aware of it. Having said that, I would not say that companies are aware of what to do about it. The New England Business Group on Health, just 2 years ago this month, came out with I thought, a fascinating study. They looked at 127 companies, some of them America's biggest companies, Boston, New York kind of based. And what they discovered is 2/3, 3/4 of HR managers in these companies have now realized, oh yeah, now I see it, this is something. And certainly see it as becoming a much bigger issue in their next few years. So 3/4 aware, only about 18% would say, I have any idea what to do about it. So that's where I think companies are now looking for the help. They've now come to this point of a little bit of awareness, but oh geez, what the heck do I do about it? And that's why you end up in this kind of rabbit hole discussion that ends up being about nothing but, more paid leave or flexible paid leave, which is fine, it's just after the fact. So we're here to try to help people figure out, yeah, here's the stuff you can do about it. The other interesting number that came out of that study is that those companies, again, basically HR managers, those types, 3/4 aware of the situation now, aware of the problem, very few having anything to do about it, but again, a full 80% saying, but if there is something, the solution does need to be web-based. Very interesting insight on the part of HR managers. We don't want a family caregiver, counselor, person online in an office. We don't want anything like that. We need kind of web-based information resources, way to manage this that can, one, kind of take the time-consuming aspect out of it for us as HR, and also so that we ourselves don't need to get real expertise on how to manage it in a micro way, but can be turned to resources that are online. So yes, increased awareness, but not yet any awareness about how to actually manage it. And I hope that's where we as the national nonprofit can be helpful.